Hi, this is Lily Cotilla. Welcome to Edging Life, looking at the world with unique perspectives. I did a previous video blog on chromosome 22 and the current scientifically accepted research stating that there are 4 different types of drug metabolizers across our global population. From ultra rapid processing down to extremely slow processing of a drug and to middle range types. So on chromosome 22, as mentioned before, there is a marker called CYP2D6 that is responsible for cytochrome P450. There are 4 variants of this gene among our human population, which affect the rate in which a particular drug is broken down within the body. This specific allelic marker and its 4 polymorphic variations determine how quickly or how slowly an individual will break down a medication. This is important to know for many reasons, because it affects 25% of SSRIs, first of all, or selective serotonin reuptake inhibitors that are prescribed for anxieties and depressions. It affects many drugs in general. So whether one is taking effexor or Zoloft or Paxil or Prozac or Trazodone or Topamax or Oxycodone or Percocet or whatever the medication is, dependent on which form of this gene you have will determine how rapidly you break down the medication. So that put aside, let's look at the pharmaceutical and psychopharmacological world. We reference a medication as having 1 half-life. So effexor has 1 half-life. Paxil has 1 half-life. Given they build in a range, let's say 2 to 4 hours, or the half-life is 6 to 8 hours. If you visit a psychiatrist or MD, they will not talk you through this or walk you through this or figure it out. It's kind of like Russian Roulette. You're given a certain amount of milligrams. Oh, it's not working. You'll go back. You're given more. Oh, it's not working. You're giving something supplementary to aid it in working. You go back. It's bumped up again. It's, brought back down in milligram dosage. It's just all over the board. If you know which type of CYP2D6 you have, a lot of this Russian roulette is eliminated. Let's take effexor, for example, and I don't know the exact half-life breakdown in hours, but an ultra-rapid metabolizer might whip through 75 milligrams of effexor in 4 hours. A very slow drug metabolizer might take 16 hours to process effexor through the body. So the amount of time that has lapsed in between one dosage and the next dosage revolves around this half-life concept, as well as the amount of milligrams prescribed to an individual. So there are lots of things and questions that this concept brings into view, such as if you know which type of drug metabolizer you are, perhaps taking medications more frequently throughout the day rather than in one big dose if you're an ultra-rapid metabolizer might be helpful. Perhaps if you're a very slow metabolizer, you don't even need the amount that they prescribe you. Or again, if you're an ultra-rapid metabolizer, not only the length of distance in time in between dosages, but you might in fact need dosages that are higher than currently acceptable or thought to be the proper cap of that particular medication. So the lab that we use at our clinic, it costs $390, and the turnaround time for the results is 2 weeks. It's an important piece of information to know, to have the piece of paper showing what genetic marker you have. And then if you have any problems, whether it be pain related or psychological related or whatnot in life, you share this with your doctor. And you might have to take a while finding one who thinks outside of the traditional box so that the adjustments can be made for your body in particular. So anyway, take it or leave it. You're your own best advocate of health and self, and doctors are great. Some don't always like participation or involvement in diagnosis and planning and ego, etc., etc. So up to you who you want to ultimately take care of you. Okay, that's it.